All right, and I'm gonna hit start. All right, thank you so much for joining, students. We're gonna wait a few moments or so as Zoom lets you into the room. We're really excited to be offering this specialty panel as a part of the Road to Residency. That is a partnership between the Tour for Diversity in Medicine, Student National Medical Association, and Latino Medical Student Association. This is now our fourth year of this program where we are really giving of ourselves to make sure that you guys are successful on this road, on this path that you're about to start, as residency applications will be opening up in just a few short weeks. We have an amazing panel. I know this is going to be the best of the week. I've sat through them all this week because it has to be the best, because we are family physicians, and there's no question whatsoever the importance and the sheer need for our field is actually without debate. And we're not even going to debate that tonight. We're really going to talk about, the next step beyond why we just chose family medicine, but really how to make you successful on your path this fall, interviews and the like. So please drop questions in the Q&A and in the chat. But for now, we're going to just go around the horn here and allow each of our very special panelists to introduce themselves. So I'm going to go on my squares here. Dr. Foster, why don't you go ahead first?
Hi, good evening, all of you all. I'm so glad to be here. This is something that I'm really passionate about, and getting to get the word out, especially about people interested in family medicine. I was fortunate to be at the Kansas City conference not too long ago, and it was just, again, a nice reminder of why we chose what we did. So my name is Chris Foster. I'm faculty at Thomas Jefferson University in Philadelphia, Pennsylvania, and I'm one of the associate program directors. I've been a part of the department since my residency. I just hit my 10-year mark being in the department, and very, very much involved in recruitment and retention and our interview season. And so I'm happy to be here to help share with you some of what I know about the changes that are coming with this interview season.
Perfect. Dr. Anderson.
Hello, everyone. I'm Andrea Anderson. I am an associate professor at the George Washington School of Medicine and Health Sciences. That's the whole name, in Washington, D.C., and where I work on a health policy longitudinal curriculum, and I'm the associate chief of our new division of family medicine here at GW. I advise medical students who are going into family medicine for many years. So excited to share with you why we love family medicine and give you some tips about applying. I'm also the chair-elect of the American Board of Family Medicine, and so we think a lot about how to get students into family medicine and ways that we can craft residencies to respond to the current needs of students. So we're all very excited for the panel to start and to try to help you out with your questions.
Dr. Lee.
Greetings. My name is Dr. Marshall Lee McCall. I am a core family medicine faculty member at Christiana Care Health System in Delaware. I serve on the recruitment team, and I'm also the lead for the Diversity, Equity, and Inclusion Committee, as well as our community medicine curriculum. I'm also the director of the Harrington Trust, which supports community medicine and health equity initiatives at the hospital. I look forward to speaking with you and sharing more about my love and passion for family medicine.
Dr. Smyre.
Hi, it's nice to meet everyone. My name is Chris Smyre. I am assistant professor at Southern Illinois University School of Medicine in Springfield, Illinois, and I oversee our anti-racism, equity, diversity, inclusive initiative for the entire department.
You're added.
Hi, good evening, everyone. I'm excited to be on this panel. I am currently core faculty at the Family Medicine Residency Program at the University of South Carolina in Greenville, South Carolina. I do a lot of work with developing our DEI curriculum, and I'm very passionate about getting students in family medicine. So excited to be here and answer your questions.
I love it. This always gets me excited. I love this. This is what doctors look like, y'all. I love this. Anyway, I'm Dr. Cameron Matthews. I am actually outside of academia, which is why I needed all these beautiful people around me. I recently joined, well, it's about 18 months now. I recently joined a company called City Block Health. I serve as the chief health officer, and we're an integrated primary care practice across 6 states now. Not yet taking learners, but very soon. That is totally my goal. So I hope to hopefully work with actually some of these beautiful faculty in the future. I'm going to start recruiting pretty soon. But let's jump into some questions. Again, students, thank you for joining, and please definitely drop your questions in the Q&A and the chat. I wanted to jump in just like to the heart of what is occurring in ERAS this year in particular. Have you been, or how have you been, actually, more importantly, advising students about signaling strategically in family medicine this year? And students, if you don't know what signaling is, we might need to take a little side conversation, because this, I think, is a pretty big deal. But I'd love to hear maybe some strategy around it, because I think some students are feeling a little bit open-ended about this. Dr. Foster, how do you think about that?
So one of the things that I've been advising my students who are applying for family medicine this year is, just like you all are nervous about signaling, so are we. This is new for us in our department. I know some of the other specialties have been doing it for a little while. And so really just being extremely thoughtful in your application. I know in the past, students would just cram their application with every single thing that they've done. And we want you to use this as an opportunity to really craft your story, craft who you are, be honest about who you are and what you're looking for. And when you're choosing your signals, again, you only have a few. Be thoughtful in how you're using it. If you are applying and you're really extremely interested in applying to a program that's all the way on the other side of the country, and nothing in your application tells me why you want to move to California or who you know who's in California, use that as your signal opportunity to kind of give awareness to that program of why you want to apply there. And that should also read through in your comments, in your personal statement. And so I know that you have a limited amount, all because you signal programs, the programs you didn't signal. That doesn't mean we're not going to look at your application, but you want to be really intentional, especially if there's something that might seem outside of kind of the normal kind of pattern, especially if you're applying to a region that's a little bit different from where you are or where you grew up. And then I'll kind of pass this on to some other folks to comment.
Any other thoughts on signaling? Dr. Smyre, what are you guys doing? How are you?
Yeah, so I would say you really want to know your institutions. So at SIU, if you are sort of in the southern central part of Illinois, there's not a need to signal to us, because that's who we're looking for. That's our area of interest. And so you signaling to us isn't going to make us think any differently of you or how we're sort of looking to fill our slots. That would sort of be a wasted opportunity. I really do agree with Dr. Foster. Using those signals to sort of signal and sort of communicate if it's not readily available, and like, of course you want to come here, right? Those are the good times to signal. But if the institution is saying that, hey, we're going to really look at those signals, then you do want to do that. So really do your homework and sort of knowing what different programs policies are on that. But our program is not really well versed in it. We do holistic reviews. So it would only be meaningful if you weren't really from this area, had no ties that were talked about, as Dr. Foster was mentioning.
That is
I would add that we are advising students as well. I agree with what's been said, and we're also advising students to check with their home institution, because some home institutions will automatically interview their own students, and so that could also be, quote unquote, wasted opportunity, waste of a signal, because you probably would already get that interview for being a home institution student, or if you had done a away rotation at a particular institution, you may or may not have to signal them because you've already indicated your interest by doing your rotation there. So it's good to check and see what their policy is.
Oh, that's perfect. I love this. I love this. Dr. Portela, thank you for joining. Why don't you just introduce yourself, just who you are and your institution?
Sure. I'm so sorry I called a little bit in late. I was on a phone call and super happy to be here in Truth for Diversity, and also seeing a lot of lovely familiar faces in the room. My name is Maria Portela, and I'm the Chief of Family Medicine at GW. And whatever question, we don't have a family medicine department, but we are changing that. Dr. Anderson and myself and many others, and looking forward to answering any further questions.
I love it. Thank you for being here. Thank you all. One question I often get, and the students are often uncomfortable, asking this, because we often stress this to students, during their sub-Is, AIs, all of that. What if they don't want to do full scope family medicine? What if they are interested in, doing a fellowship, which is totally legitimate and everything, but how do they answer the question if they get asked, doing full scope? Because we love that just entire focus within family medicine, but not all students want that. How do you advise them to approach that question? Dr. Adu.
I would say be honest about what your interests are, because if you go to a program and you say, I have this particular interest in OB, then now give the program the chance to kind of like tell you about what the OB experience would be like. And then also the programs may have a fellowship attached to it as well. And so if you have that honesty from the jump, then they're going to be able to tell you what resources they have available to them. And they'll give you information about historically what fellowships people have matched into who have graduated from the program. So that honesty is very important, but also if you don't have an interest in OB, don't say, oh, I don't want to do OB at all. Like, you're going to have to do it to be a well-rounded family medicine doctor. So just be open to all the experiences that are going to be offered to you.
Perfect. Any other thoughts? Yeah,
Yes.
Dr.
I completely agree. And family medicine, the beautiful thing about family medicine is that you really have the opportunity in many ways to specialize within family medicine. My current role is mostly public health, and I serve as almost like a pediatrician. I'm a school doc at an elementary school. But the beautiful thing is, when I did my family medicine rotation, I excelled in all those different disciplines. And so if you're interested in those different niches within family medicine, that's cool. But when you're interviewing, you still have to express and convey interest in the full scope of family medicine. Nothing annoys me more than someone saying that they're interested in sports medicine, because we have a sports medicine fellowship, but then you ask about pediatrics or OB and they have no interest. And so at least during the interviews, you need to express interest in those other areas as well.
I love that. I love that's so true. Don't block it out, but you can at least acknowledge that you have some directed interest. That's great.
And
What are you
can I add
Oh,
really
please.
quickly? I mean, and your interest can change, right? Like, family medicine gives you a full breadth of exposure and contacts, networking, I mean, all the things. And so maybe for the first 10 years, you thought, I'm going to be a sportsman. I love sportsmen, sports. And then you're like, oh, look, public health. Oh, look, I'm going to become a pizza butt, like whatever is the thing. But family medicine is like the pluripotent stem cell, right? Like, you can become whatever you want to grow into at whatever point in your life you want to grow into that thing. And so it's important to give your full attention to everything, because you never know what life will bring you.
Dr. Portela, go ahead.
I totally agree, and I love the stem cells reference. I was actually just talking to one of our faculty members before this call, and we were discussing how they could change their path in like 10 different ways, right? And that is what family medicine is we embrace and we like everything, and it's okay if you at certain points prefer or veer towards different areas. Just looking at a slide that Dr. Anderson and I were working on earlier today, is less than 18% of family medicine docs do obstetrics currently. And then also about a third of family medicine docs do actively inpatient medicine, right? So I don't think that people that are interviewing you are going to be flabbergasted if you say, I don't want to be a hospitalist or I don't want to do inpatient medicine. So being honest, but being also open to different opportunities and to the fact that until you try and you actually practice on those fields, which hopefully you like because you're going into family medicine, you actually don't know if you're fully gonna like it or not.
Dr. Costa.
Sorry, I don't want to belabor this question, but I think the one other thing I just wanted to comment on is that this is such an important piece of your search as you're looking for residency programs that you want to match at. You want to pick programs that are like interested in as well. And say, for example, I don't want to harp on OB, I love OB. But if you do not see yourself in the future practicing obstetrics, do not apply for a program that has heavy obstetrics, right? Choose wisely, pick your residencies and learn what they have to offer for you. Understand what those schedules look like. You all don't want to go to a program where you're going to be miserable and upset because you have lots of OB call and you're not happy about that. So make sure that this stage where you're looking at programs and picking which ones you're going to apply carefully, because you want to pick something that's in line with what you're hoping to match, right?
Fabulous. Oh, thank you guys so much. We have obviously a very targeted audience that we are interested in joining our ranks. How should they be differentiating between programs as a underrepresented student? Should they be asking specific questions? Should they be looking for specific support, or should they just be silent and look at a website? How are you advising students who have, you know, some vested interest in diversity and equity and feeling supported? What should they be looking for, Dr. Smyre?
So I think that's really important. And I think especially if you're doing virtual interviews, a great way I tell everyone is say, if I was in person, I would get a sense of the culture directly. But since I'm not, what are your numbers look like? What are you doing? What are your plans? Sort of what do you think is a growth area or things that are coming on the horizon you're excited about? I think it's important to know that just as much as you're wanting us to say yes, we're also wanting you to say yes. And so we may have made a lot of offers, but because of how we present ourselves, no one said yes back to us. So a class may not be as diverse. And if it is important to them, they'll have thought about that. And that's the most important thing in that response. Is it something that they're making up on the fly, or is it something that they thought about? This is important enough that they have pre-planned responses and insight about what they're doing differently, what they learned from others who have come through. And I think the more informed they are in their response, the more likely you're going to have support or have people who are already thinking in advance about what they can do to sort of help make sure that you thrive and excel.
Right.
I agree. And I am going to give a very old school recommendation that has become very outdated in a couple of things, but I still like the table and the process that it recommends. There's this book called The Easterson's Guide of Getting into a Residency Program. Some of the recommendations are very gendered and stereotypical, and you can ignore those. But they do have this matrix of how to rank your top programs that I really like, because depending on how the individual is, it's very analytic. So it forces you to apply a value from 1 to 10 to the core main characteristics of what you're looking for in a residency program. And for me, when I was looking for a residency program, one of them was culture, and one of them was diversity, and one of them was equity, as Dr. Snyder mentioned, and then one of them was also, what was it? I'm trying to think. Was the ability to participate in committees and that were equity related, and or leadership opportunities. And you're forced to, or you're encouraged to, apply a value, and then there's a multiplier. So it shows you how to apply a multiplier, and then whatever program you go into, this is very specific, but you assign a number, and then you have like a numerical value to what your important factors are. So I would encourage, if you decide to go through kind of an approach like that, which is okay, and if it's okay if you don't do it that way, to apply and very intentionally mention these core values that you have of equity, like Dr. Steiner mentioned, and diversity and culture. And also to ask residents, or usually you will get at least a couple of residents' emails to ask them about their experience, right? And you can ask them about the diversity of this of the resident class, and there's different levels of diversity. I remember that I went to one of the reasons why I chose the program that I chose was because 50% of the new residents, like it was like the fastest growing population at the time, which was unbelievable to me, were Hispanics. And I thought, wow, there's, the Hispanic population is booming. I'm gonna go and make a big difference there. I also thought there were more representation than I thought when I actually got there. I don't know how I got that confused. So ask around look at the fellow residents and make sure that, think about whether you would feel comfortable there, because the culture and how openness to diversity and inclusion is, it's very important.
All right, we've got a question coming in around board scores. Actually, should a student who fails step 1 have their step scores available before September 27th?
I would say yes. And for me, I think I strategically did the opposite. I passed step 1, but I was nervous about step 2. And I was like, okay, Marshall, you passed step 1, but I didn't want to risk my luck. And so I didn't take step 2 until December. So if you know that you have some issues test taking and may have some difficult rotations and are not able to commit the time to study, I had my sub-I that fall, so I didn't have the time to study and dedicate to studying for step 2. I would recommend if you can withhold that step 2 score until you have sufficient time to dedicate to studying. But definitely, if you did not pass step 1, it's important that you go ahead and excel. I would excel as best as possible with step 1 and passing before you apply, because many programs will not even look at you if you don't have a passing step 1 score.
Thank you, Dr. Smyre.
I think I just want to echo what Dr. Lee was saying about taking it when you're ready. So if you didn't pass, you retook, you passed step 1, and you're feeling pressure to take it before, yes, that'd be great. But if you don't have the time to adequately prepare and you're not confident you're going to pass step 2, it's better to wait and take it so that you pass on that first attempt than having multiple failures on your application just because you were rushing it and you didn't take the necessary time to really maximize and show your full potential.
Dr. Adam.
I just want to echo everything that's been said so far. You want to make sure you are ready, but also be aware that every program has its different filters as to how they are going to offer you an interview. And so it may be maybe 1 or 2, one fail on step 1 may be like something that disqualifies you. And so my school is telling me that you want to be sure that you have your step 2 score when you're submitting your application, just in case they filter you. Not all programs will filter you out if you don't have your step 2 score already, but they will not rank you when it comes closer to match time if you do not have your step 2 score. So you want to be sure that you're ready to pass step 2 prior to when rank lists are submitted.
And I'll just double or triple echo kind of what's been said, but to add, I think a lot of programs have gotten more savvy about displaying their information about what some of those filters might look like for programs. If you hadn't completed and passed step 1, that might be a reason why a program may not look at you on the first pass. And so you may want to dedicate your efforts or kind of divert your efforts in a different way. So be very thoughtful when you're reviewing the websites of these residency programs. You might find a lot of the answers that if you spend your time emailing a program director or emailing a program coordinator, information that's already available on the website, that will kind of show that you weren't being attentive and weren't really looking through the resources that were already available. So just be mindful of that. And also be truthful about your exams. I had a couple of students in the past who they told us that they took their step and it turned out that they hadn't taken their step 2, and we got all the way to the point where we're putting together our rank list. And it was a little disheartening to know that, there's so much fear and kind of just being honest and truthful about your exams and your scores. And so be honest, talk to your advisors, talk to your mentors at your programs, but I think it's really important to just be truthful in the entire process as well.
Have to be. Honesty is critical. Actually, kind of piggybacking on these questions around scores, one student emailed as well, we'll need to take step 2 in September. So definitely hearing all that you're saying, that it could be a weeding out point, it could be detrimental in different ways. Where would you recommend that perhaps they even delay in applying until 2024? Do you think taking it in September is sufficient, or do you think there's a risk there? Like, what scenario would you say where it's getting too risky?
Everybody's different. It depends on, one, how did they do on step 1? How has their standardized test taken been during medical school, and have they put in sufficient time to studying? And so there's no one answer for everyone. And if they've dedicated sufficient time to studying, I would recommend that they take it. But if they know that they haven't dedicated sufficient time, they may want to consider delaying, because again, repeating those exams are a bigger detriment than delaying taking those exams.
Great. We got step questions everywhere, guys. This is a perfect direction. Let's say a student, you guys can see it in the chat, attending an osteopathic program and opted not to take step 1. Would you discourage them from taking step 2 without a step 1? Or does it help if they're predominantly applying to allopathic programs? How do you advise the osteopathic students? Chris.
So we actually have several DOs that we take fairly consistently in each class. My big question would be, are you planning to get sort of licensed and certified through your osteopathic training? Because if you are, then technically you don't have to. You should know what programs will still take that as a valid license, and and all that kind of stuff, as we would. So I have some residents just graduated that got their license in osteopathic medicine, not allopathic with the step scores. But if it is a predominantly allopathic school and they are not going to really be looking at that in the same way as equal, then that is going to be something that will potentially put you in a more disadvantageous spot, because they're looking for you to be certified the allopathic way with step 1, step 2, and then step 3. Taking step 2 versus step 1, that's more about preparation, because at the end of the day, you need all 3 to get your license. And so if you're just doing 1 to get in, I don't know how that will be viewed, because if you could do 1 and get in, they probably didn't even care to begin with, as long as you were certified and licensed so that you could practice day 1.
Dr. Lee.
I agree. Our program is dual accredited, and it really wouldn't matter if you have not taken step 1 or step 2 for our program if you've done well on complex. And my recommendation would be preparation for step 1 versus complex are completely different. You would think they're 2 standardized exams, so if I do well on one, I should automatically do well on the other. And unfortunately, they're not the same. And that's one of the things that we're still pushing the board exams to be more similar, because if you're going to take step 1, step 2, you still have to put in sufficient studying for those individualized exams. And so if you're not able to put that effort in, I would recommend that you not take the exams.
All right, guys, let's switch up. Thank you, students. I can tell step scores are an important part, but I want to hit on some other topics. Let's say scores are out of the way. What are the, I guess, how do you guys weight? How do you guys prioritize the experiences that they're listing in ERAS, the information in their personal statements, the information in letters of reference? How are you weighting all of this information in the applications? Because I know students feel nervous about what they put here, what they put there. How are you looking at any of these? Or do any of them jump out as the absolute most priority to you? Maybe is a good way to ask it. Dr. Adu, any thoughts there? Oh, sorry, Dr. Anderson, go ahead.
Yeah, I mean, I would say the way I advise students is to place the things that you're most passionate about and the things that you're most versed in. Um, like maybe you did rather than what you think should be impressive, you know what I mean? Like, so, let's say you did some research with, a very famous person, whatever, but you did it so that you could have a paper, but you weren't really involved and, you didn't really love it. It wasn't like, this is so great, why I did this, but you've been running your student health clinic for 4 years, and that's what you really love. Or you've been, a mentor at the school, at the elementary school, whatever the situation is. And that's what you're going to really light up about while you're talking and really show like you're very passionate about that thing. I would say the beauty about family medicine is that we want a well-rounded applicant and someone who loves family medicine, loves families, loves being with different kinds of people, and wanting to improve the health of the community. So I think that definitely defer to the residency faculty, but I would say as an advisor, I advise the students to talk about what they feel the most passionate about and what they feel has most shaped them and will be most influential to them as a future family physician.
And then just to kind of echo on that, like speak upon the things that you're passionate about, but also like if you did one community service event for like 1 hour and you can't really speak on that, like don't add it to your CV. It's not going to be something that's really going to kind of speak to who you are and what your interests are. But if like you were like president of SNMA or you did a lot of stuff with SNMA, then like speak on those things. We want to hear the passion, because the passion kind of brings out your character and we get to know who you are a little bit more. And we also get to see what you're going to add to our residency program. And so add things to your resume that are going to just allow us to really get to know you as a person, because that's what's important to the residency programs. And then in terms of what are recommendations, like try and get it from someone who can speak on your clinical acumen. Like don't just ask anybody just because you did one day with them and you had a good experience. Like try and get somebody who you had a longitudinal experience with, who can really kind of talk about your growth and your clinical knowledge and how you would be an asset to a residency program.
Can we pivot to that letter requester point? I think this is really important, and I appreciate you bringing that point up. I think, when I've been meeting with students and they've been asking for letters, one of the things that I think is really important is to really be thoughtful in who you're asking for a letter from and why. Right. And I think like, to your point, Dr. Adu, like you work with a student a few days, like, yeah, I can write a letter about you, but how is my letter complementing your application? How is my letter highlighting who you are? And like, sometimes I feel like I'm doing the outreach for the student. I'm like, hey, you need to meet with me so we can talk about this, because I don't want to just write a generic letter on your behalf. I read a lot of letters and I know what it takes to write a letter and read a letter that really means something. I need you to give me something so I can help you out here. So be thoughtful when you're requesting a letter of recommendation. Don't just give them your CV and say like, write a letter for me. Tell them how you can be helpful to help them write the best letter possible. What characteristics do you want them to highlight for you? And if they feel that that's in line with the experience that they've had, I'm sure your letter writer will use that as an opportunity to kind of springboard into, their commentary. But like, again, you might be asking 3 different people for a letter. You don't want 3 of the same exact letters. So just be mindful of who you're asking for your letters and be really thoughtful in how you're requesting them. Provide them with as much information on the forefront that you can so that they're not having to dig for information, because you don't want your letters to all be very generic and say the same thing.
Yes. Along those lines, you should be able to gauge the interests of your letter writers. I will easily say, I'm not able to write a letter for you. And I let the students know, because if I haven't worked with them in depth enough and I don't know enough about the student, I will let them know I'm not able to write a strong letter recommendation. And so you have to be thoughtful in who you're asking. That at least is on you as well. But when you're asking the question, you should be able to ask, will you be able to write a strong letter of recommendation? If they're not able to say yes, or if they're on the fence when they respond, that's a sign. If you've asked the person 3-4 times and they still have not submitted the letter, that could be another indication that they're not that eager about writing a letter. You may consider asking someone else. There's nothing worse than reading letters and then the letter writer has mentioned somebody else's name in the letter, or referred to the person as he, she, a different gender than what the person is, or even the worst is a different specialty. Writing a letter for Sarah who's applying into internal medicine. That really is a signal that the letter writer does not know the applicant. So be very thoughtful in your approach to who you're writing, asking for your letter of recommendation.
Dr.
Just
Smyre?
to, just to add to that, if you get the response where they're not enthusiastic, it's okay just to say thank you and just get someone else, because they don't know after they upload it where you send it. So you don't have to say, never mind, I don't like that response. Just, all right, mentally note, and then continue to find other people that you can ask. And the other thing too to think about is all the aspects of your identity, your value, your interests, you probably can't fit solely in your personal statement, your experiences. And so you may then be able to say, I'm not going to talk about this piece as much because I'm going to trust my letter writer to sort of emphasize and talk on that. And so you can get all of your components expressed in your whole portfolio because you have people who can then give more space to further elaborate on things. So you may allude to something and then expect this person to go into more detail about how they've seen you engaged in that health clinic, or seen you really involved in the research and learning and growing, coming up with new questions and ideas. And so that when we're saying think strategically, it is saying, how can you ensure that each piece of who you are is conveyed adequately to the residency program? And that's sort of how you can go about finding who's the right thing, what's the right pieces that need to be commented on.
Love that. Love that, guys. Thank you so much. We have a fair number of schools around the country. They're letting the tour know. We're posting it on social media and everything. We've got open houses, we got second looks, we have all these different events. Are these important to attend? How should students maybe try to stand out during these? Like, what do you suggest about the interaction? Because some of them virtual, it's even hard. Like, what is your advice around these events?
I really, really like this question. And I'll say it's, at least at our program, for the open house that we had, we made it we made it a webinar similar to this, where the participants were not able to be identified. We wanted it to be information for them, not a judgment point from us. We didn't want people to feel like we were judging their questions. Everything could be asked safely and anonymously. And so I think it's important to kind of use those opportunities to get your questions asked and not to feel ashamed or concerned about the questions you're asking. But I do think that it's a really big change since COVID has happened and we've moved to doing all these virtual spaces, and people having fears about how much they need to show up, right? You have rotations, you have lives, you can't go to every single webinar. That would be every single evening of the next 4 months. So be thoughtful about how you're choosing and selecting to participate in some of these webinars. Some will be recorded, some might not be, some might overlap with life events. And you're just going to have to do your best to get to the ones that are really going to help you make the decision that you need to make. But don't feel obligated to go to every single one. Do not, exhaust yourself trying to do that. Just be thoughtful and really think about which ones might be helpful as you're curating your list and trying to make your decisions.
I agree. And if you show up, make sure to show up. You are pre-interviewing when you attend those events. Ours is not this type of format. There you would be able to come on camera and ask questions, and so treat it like you are interviewing. Don't go in there too informal. Wear a nice shirt. Present yourself as best as possible. So if you're going to show up, put your best self forward when you show up.
And just to add to that, like the way Dr. Lee's on screen, bright lights, you can see from the shoulders up. The way I am, you just got my head, you can't hardly see my face. This is not good lighting. This is not, you would want to be able to, so if you're wearing a tie, you want that so you can say, hey, he has a tie on, he is dressed professionally. And at these events, there's so many people, oftentimes, unless you do something really, really great, really, really bad, you probably won't stand out just from the conversation, that one interaction. And so the most memorable people are the ones who actually follow up. So if I give my number out, I remember and take stock of who follows up and takes advantage of that to further ask questions or further talk about their passion and interest, more than the 1,100 questions that people just had as they were going through getting the information that they want to answer.
Last thing I would add is to come prepared with informed questions and not questions that could be answered from the website, like how many residents do you have a year? I mean, you could look that up. Right. So what city is your residency? I mean, look on the website. But, if you're going to, you can make up. I always tell students, if you don't have a question, just make one up, but make it be like an informed question, like, what aspect of your residency program are you the most proud of? Or, I read about your global health experiences. What other countries are you looking to expand this to? Something that shows, you always want to, this is true on the wards too, right? When you ask a question, you should say like what you know first and then ask your question, right? So, I was really interested to see the research that, such and such was doing from your program. Tell me more about that, right? Or I would like to do research that's similar. Would there be an opportunity for me, right? So that it shows that you did a little legwork, you looked into it a little bit. And I definitely agree with Dr. Smyre, the follow-up, not just the generic, like, thank you for talking to me, but, hey, I'd love to, is there are more things that I could read about, or are there, here's a follow-up question that I thought about afterwards, so that they can see that your interest is still piqued and you still want to hear more.
And then try to attend like virtual open houses or things like that for programs you're interested in, because I know for my program, we keep a list of like who's attended different things, and then based on who has attended various open houses or things along those lines, those are people who we kind of like look out for when we're trying to offer interviews. And so this is a way to kind of get your foot in the door if you're able to attend the open houses.
Here's a question from Christopher. Should we be reaching out after the open houses? Are we setting letters anymore? Are we doing is signaling it, or are we doing extra effort even with the open houses? What do you recommend?
Non-generic is always better. So a general generic one is like, oh, that's nice. I'm going to put it either in a trash can or give it to my coordinator just to keep on file. But if it's sort of, you can see there's real active thought going on, I think those are the more meaningful ones as far as where you are. Because at the end of the day, a bird in the hand is worth more than two in the bush. And so the whole problem is that there's not really a great way to screen all the people that are applying. So if you can build a relationship and say, this is a really great person, they work hard, they follow up on stuff, they're really intellectually engaged and stimulating, things like that. They look like, and talk about serving patients in our community as a passion of theirs. So they're not going to be worried about burning out or being frustrated with what we offer. That's who I want to interview, because that's most likely the best fit. And it really is about fit, because there's so many different family medicine programs. There's so many different sort of emphasis within family medicine programs, despite you're still gonna get that breadth. Some programs have 4 months OB, some you only have 2. And so the programs with less, that probably telling you that's not as big of a focus for what they're looking for and the types of trainees that they're trying to produce, than the one that does have, like, you do that throughout all 3 years. And so the more you can align and demonstrate that, hey, this is a solid fit, the more that's going to communicate and sort of leverage you to be able to get that interview.
Talking about solid fit, or maybe lack thereof, do residency programs look at social media accounts? Are we screening on Twitter or X or Threads or whatever the latest one is? And should students be like friending, reaching out to faculty members, residencies, program directors on all of these different things? Like, how should, so much of their interaction is in that space now. How do residencies consider all of that? I saw a bunch of like
we all made a face. We all made a face. So I think there's some unified thoughts here. I'll kind of speak on it. For our residency program, we've allowed our residents to kind of man our social media account, but that doesn't mean there's not oversight. And so I have access to the social media account. I make sure what the residents are posting is well curated. And similarly, I can see messages that can come from other applicants. I can see what they like and don't like. I'm not keeping a list. I'm not creating a running list by any means, but I think just knowing that there are faculty who are attached to these social media accounts, just as you would anything else, you want to be mindful of what you post, and you want to be just thoughtful about how you're presenting yourself in any space that can be accessible. I am not going to LinkedIn to search for someone. I don't have that time or that bandwidth to do it, but maybe there are some programs to do. And so just be thoughtful about how you're presenting yourself online.
I hate that we're still advising about that, but it is still a huge issue.
But I would agree, just like personal friending or personal, I mean, if it's the residency, website, or, kind of like the Instagram or Twitter account of like the residency, I think that's one thing, but, personal reaching out to faculty, I think that might be not as not as welcomed. But I mean, maybe some faculty might, but I think in general that might come off as slightly odd. During at least during the interview process. Maybe once you're at the program, it's a different thing. But during the initial process, I probably would, opt against that.
And I will say I did something that was out the norm when I applied or was interested in a program. I trained in New England, and I was interested coming back down to the Maryland DMV area. And so I really didn't know a lot of residents. And so this was before Facebook was the social network. And so I found there was a resident at the program that I was interested in, and I wanted to know more about the program. I did not send her a friend request, but I did send her a message. And I'm like, in hindsight today, that may not be the most appropriate thing. It may be okay to go to LinkedIn and probably send her a message there. But I will say, definitely do not friend the person, because it comes off a little weird. But if you're not able to find their email address or other contact information, you may be able to find other ways to contact them as well. But make sure you're presenting yourself professionally and have good questions when you're reaching out.
And you can always email the program coordinator if you would like a specific contact that you don't see available online. You can always feel free to do that. I don't think anyone would push back.
And one last thing I would add, just piggybacking on what was just said, that if your profile is public, make it private, right? Because as soon as you like the residency program website, or you kind of like the Twitter profile or X or whatever it is, or Threads, then they may be able to have access to some of your information, and you want to have whatever is in your profile consistent with all of the stuff that you're signing up for, right? And one of the things that you're going to be evaluated on is professionalism. So just one of the things to keep in mind.
I love it. All right, so we're coming closer to the end. I do want to, just because I think we all have a real love for family medicine, I would love to go around the group and go right back to that question that I said we wouldn't necessarily focus on, but we have to. I would love to hear from each of you why you chose family medicine, maybe even a little bit about why you still love it, and why you recommend it to students. What's the big selling point when a student maybe is still a bit undecided. We may have some students who are listening in that are trying to make a decision. So what would be your advertising point? Chris, go ahead.
So I would say, one, I am one of the family medicine that still do OB, 4 years out of residency. And so it's a lot of fun. And I really think for me, I didn't want to be in a situation where I hear a problem and I have to say, I heard it, I recognize it, and it's not in my scope. It's actually not my thing that I can address if I know the answer. And so within family, you are the quarterback. So if you're not directly solving it, you're linking that patient to whatever specialty or service is needed to address the issues. And so being able to really be at the primary and forefront of saying, any problem is my problem to deal with. It's not going to be outside of my scope, and sort of determining what next steps look like is important. And I think the other big thing is the language and breadth of knowledge you have, especially for family, so that if they're seeing neuro, I kind of know what they had to do to get the neuro. And I kind of know, like, that doesn't make sense. Like, let's ask them these questions. Like, let this make the specialist make this make sense to you, right? And so being that advocate and having that breadth of knowledge to know the right question to ask, or to know, like, this is just not following logical here. Like, break this down again, or you just in a place where we don't know. So let's just admit when we don't know, which can sometimes be a hard thing for providers and physicians to do. And so being the quarterback and having responsibility, being able to have the information to advocate for family, and just being equipped with a diverse set of skills is why I still love family and recommend you guys to go into it.
You're muted.
I said, yay, we love family. I'm so excited. Dr. Foster, go ahead.
So this is such a hard question to answer now, because over the years, my love for family medicine has grown. And so I could talk about it all day. And that's why I went to Kansas City, so I could just talk to people all day. I would say that the thing that has kept me, my love and passion for family medicine is really that opportunity to be that person for a patient who may be lost, who may be confused, who is trying to interpret the medicalese that they've been presented with, and being able to kind of partner with that person as they are figuring it out. We may not have the answer today, we may not have it tomorrow, but we will work together and figure it out. And I just really love being in that position, even if, we don't have the answer, but some people need to have that assistance and that partnership. And it's always really nice when I'm like working with learners, and I had this experience again today. It's always just so beautiful when you have that patient who's finally found someone who they want to be their doctor. And when they ask them, will you be my PCP? It melts my heart every single time, because I think those relationships are so powerful. And I love that opportunity to really be that person for someone else.
I love that. Dr. Portela, why do you love family medicine?
Thanks. Okay. Well, I think I knew that I wanted to be a family medicine physician before I went into medical school. So it's a little weird in the sense that during college, I started working with community organizations and nonprofit organizations in interdisciplinary teams. And I noticed that there's a thread here, but that I just loved public health, and that I loved kind of hearing different perspectives and helping communities be healthier. And I knew that I loved science and loved helping people, and family medicine seemed to be logically the best choice to kind of integrate public health and be able to, throughout medicine, really see where people kind of fall through the gaps of a kind of broken healthcare system that I was looking to understand a little bit more of. So that's how it started. Then as I started learning more about family medicine, it became very clear what Dr. Foster was just talking about, that the relationships and the trust is at the center of everything, and that they're this very powerful force. And when I went into other rotations, which I also happen to love, like any other family medicine person, I was always missing that piece of what will happen to the patient next. What will happen to Mr. Jones? Like, will he be okay? Did I diagnose them correctly? And that kind of thing kept me up at night a little bit, not like a ton, but a little bit. And then I also found a lot of satisfaction from once I was a resident in family medicine, being able to be a family's doctor, but not like a family doctor, but a family's doctor. When the mom, the grandma, deliver the mom and you see the newborn, and then they bring their uncle and whatever. I just found a lot of joy in that. And I also thought that it was a more holistic, better way to provide care than all this fragmented mess that we have in a lot of our healthcare system. So I would say I love relationships, public health, and health policy, and family medicine was all of those things. And I think there was one more. I think the last thing I would say is that I also like the idea of sometimes being in the best day of somebody's kind of life, right? Sometimes you're that doctor that either delivers the baby or that gives a patient like amazing news, or that high fives them when they stop smoking. And that's a very awesome thing to be able to have like a tiny but powerful influence in somebody's like health habits and ability to kind of be healthier. And also sometimes you're there in their toughest moments, right? Like when at the end of life, or having very tough conversations with family members, or giving bad news. And I think that's a very powerful part of the relationship and everything in between.
Thank you. Dr. Lee.
I've always been a social justice, health equity enthusiast. And so I like to look at the history of different specialties and things when I was deciding. And so I fell in love with the founding of family medicine. Terminology such as social determinants of health, it may not have been called that then, but those were the things that our discipline was built upon. Understanding the factors that affect our patients, and not just understanding the factors, but being a doctor that was willing to understand how we can support our patients outside of our clinical setting. And so family medicine has always taken that holistic approach, that multidisciplinary approach to caring for our patients. And I'm also very interested in health policy. And so when you're working with legislators and different lawmakers, it's important to have a breadth of knowledge when they're consulting you or when you're advocating for different topics. So those are some of the reasons why I continue to love family medicine.
I love it. Dr. Anderson.
I would agree with what has been said, loving health policy, loving advocacy, loving longitudinal relationships. Family medicine and primary care is the only specialty that adds life expectancy. The numbers of family physicians in the community is greatly beneficial to the health and well-being of all members of the community. And I think this is maybe weird to admit, but when I was growing up, my favorite show was Little House on the Prairie. And they had the doctor who was always around, like he'd be at the mercantile, and then he'd be at church, and then he'd be like riding his horse, just kind of like with the community, knowing things other than, you have a cold, right? He knew like how old people were. He knew like what was going on in a family. And, obviously, that doctor did not look like me. However, the idea of being a community physician, celebrating things other than, specifically medical things, right? Understanding patients within the context of where they live, where they grow, where they learn, where they worship, where they play. It's always so important in family medicine. And I remember one really great experience I had when I first started. One of my patient population was almost 100% Spanish speaking, a lot of new immigrants. And I remember one of my patients had recently gotten her citizenship, and she saw me like across the street. We were like walking in our neighborhood, and she had just voted, and she like put up her hands. She was like, "Doctora, you voted!" Like she was like so happy that she voted. She had voted. It meant so much to her. And as her physician, I knew the whole struggle that she had gone through to be able to say that. And it was just this moment. Like she came and hugged me, and she was like, "Doctora," like it was so exciting. And I was like, "Wow, this is what a doctor is." Like I'm not just like, "Oh, your blood pressure is better," but I'm supporting something that, can change the direction of her whole family and her whole trajectory. So that's why I get excited about family medicine, because we have the potential to really change the arc of someone's life.
Dr. Adu.
And so the reason why I ended up choosing family as a medical student was the ability to like do different specialties within one specialty. Like I did not have to make that decision. I'm able to do peds, able to do OB. I am an OB provider. And one of my favorite things as well is, and I feel like this is a huge compliment, is like, I remember during residency, I got a daughter, and then she told her dad about me, then her mom, and that I actually got to take care of the whole family. And I thought that was one of the coolest things, to really take care of the entire family. Plus, since I do OB, I'm able to deliver the baby. Then because the baby's pediatrician, I'm also the doctor for the mom. And so I'm able to like kind of have follow-up with mom during the kid's appointment. And I think that's such a beautiful thing to be part of, because I feel like I'm not just impacting one person, I'm truly impacting the entire family. And there's no other specialty where you have the ability to do that. And so those are a couple of reasons. There are a lot more reasons, but I don't want it to be too long. But yeah.
I love it. Oh, you guys are so special. I'm going to add in something that I now see in retrospect. It's not the reason why I initially joined it. I joined it for all of the reasons you guys said. And Dr. Anderson, more than anything, like the fact that we connect with that patient when she first voted. I was like, I want to connect with people when they are well. I want to connect with them for the bigger reasons that they are a person as opposed to a patient, right? We talk about whole person now. But I really believe family medicine, that's an expectation. That's part of our training. It's not something we need to like figure out now that it's like a popular statement, right? But in retrospect, what I'll add, and I think some of you get this, I actually think it's yes, the health policy piece, family medicine is an important perspective to have, but I actually think leadership in healthcare, leadership in medicine and healthcare, family medicine is the best place to lead from. We understand the interactions of the system. We dip into the finance side a lot more with our patients than other specialties, I would say, and maybe that's primary care, but I think it's family medicine because we're really thinking of them holistically. You know, when we're talking about managed care, when we're talking about, you know, really leading and transforming within healthcare, I think family medicine is the best platform to do it from. And that's why I chose my practice that I'm with now. I want to change things, and I don't see the perspective that other specialties have as being as wide ranging to be able to do that. So leadership in medicine, I think, is perfect for family docs. So with that, I am going to, yes, we're cool people, exactly. I'm going to bring this to a close. I want to thank these beautiful, beautiful people on the screen today for helping us, and to all of our students with us live as well as watching this on YouTube at a later point. Thank you for choosing family medicine. We look so forward to you coming onto this side and joining us on our teams. We got a bunch of states represented today. Apply to our programs, come join us. We look forward to seeing you in family medicine. Thank you guys so much. Have a great night. Thank you all.